Dementia. It's the optional condition. It's the euphemism for Alzheimer's. It is the whispered word. Yet, it is the 5th largest cause of death in the elderly. If Alzheimer's disease were a world economy, it would rank as the 18th largest. It's been the optional condition, but the World Health Organization for the first time cited a chronic disease, Alzheimer's, as a significant threat to the health of all nations. The National Alzheimer's Project Act lends legislative clout to all efforts to find a cure for Alzheimer's disease. The annual Medicare wellness visit now mandates that a question regarding cognition be asked of all individuals coming for that visit. The Alzheimer's Association redesigned diagnostic criteria for Alzheimer's disease to include even a preclinical state that is now a target for all therapeutic interventions. It's not optional anymore. It's essential to diagnose and treat dementia, but the barriers to care are still there. Hi, my name is Ronna Schatz. I am a Picker Ward grantee, and along with my colleague Wendy Lemire, we are trying to break down the barriers to dementia diagnosis and care. Our Always event is to screen every individual over the age of 70 at their annual wellness visit for dementia. The project is a pilot with 2 primary care sites in the Henry Ford Health System, Dr. Gregory Kroll at the Sterling Heights Center and Dr. Lynn Johansson at the Farmington Hills, Michigan Center.
Hi, my name is Wendy Lemire. Primary care physicians are key in the process of diagnosing dementia, but they face numerous barriers. There is a lack of time for assessment, uncertainty regarding diagnostics, complexity of administering and interpreting cognitive testing, and a lack of resources for management of behavioral and social issues, community resources, and caregiver training. Our project attempts to break through these barriers with our interventions. We employ web-based tools for cognitive and behavioral assessments. There are electronic medical record templates to guide physicians through the process of identifying a specific dementia syndrome, standardizing medical and non-medical management, and aligning patient and caregivers with a network of community supports.
Our strategy consists of 3 interventions. Using the National Institute of Health toolbox to make a cognitive diagnosis is the first rung. It is a public domain, web-based cognitive assessment tool normed for persons aged 5 to 85. It is funded by the National Institute of Health under the direction of Dr. Richard Gershon at Northwestern University. Testing is done separately from a physician's visit to provide an optimal testing environment and standardization of administration. Using smart technology allows for automated adjustment of test material to a patient's true premorbid level of functioning and provision of alternative versions for retests. Testing takes 30 minutes with minimal requirements of a trained technician, a dedicated laptop, and a monitor. For this pilot, our staff will be providing an interpretation, but ultimately the test will have automatic interpretation. Our second intervention is to provide electronic medical record templates which serve as a standardized exam guide, direct entry checklist, or dictation guide. It can be accessed through CarePlus, our system's electronic medical records. It guides the diagnostic history, the physical exam, tests, and treatment. Most importantly, it identifies when a condition is not Alzheimer's disease and requires a referral to neurology. As soon as a person is diagnosed with Alzheimer's disease, they not only access their physician for counsel, but they walk right down the hall to the Alzheimer's Association social worker, where they and their families can meet for orientation and more information. The Alzheimer's Association social worker is employed by the association and not Henry Ford Hospital, but they're housed right where patients are seen. This part of the model is based on a similar program implemented by our multidisciplinary memory clinic through a private grant. This program is sustainable through billing for social work services.
All three core pillars are further supported by a patient and caregiver advisory board. They provide feedback and input at quarterly meetings through every step of the process. They will help us understand attitudes toward dementia, Alzheimer's disease, brain health, and screening for dementia. There will be a hands-on interface with the National Institute of Health Toolbox. They will help with evaluation of the diagnostic process and discussion. They will help with ratings and recommendations regarding social work meetings.
Our goal is to make this project work not just for Henry Ford Health System, but for any medical system. Our templates and flowcharts can be made available to anyone who has an electronic medical record. The Alzheimer's Association exists in all 50 states, and it is possible for every association to hire social workers and house them in clinics. The NIH Toolbox will be completed by September 2012 and should be available to any healthcare system for their use. Our vision, like the Alzheimer's Association vision, is a world without Alzheimer's disease. However, until there's a world without Alzheimer's disease, our vision is a world that can treat Alzheimer's disease.